The doctors of the PermaDontics Center appeared recently at the Aging Expo in San Diego to reach out and better educate the public about their same-day teeth solution and the PermaDontics difference.
A lot of patients have been told that there's really no hope, or they've been told that the treatment's going to be extensive, it's going to take a year, it's going to be difficult, they're going to have a lot of pain, they're going to need bone grafting. They've been told a lot of things. And so the way we devised this treatment is that we've eliminated a lot of those problems. And so we were able to eliminate having to do bone grafting most of the time. And so the treatment overall is just a lot easier for these people. So there is hope actually for these people, and we want them to know that.
I'd been through root canals, I'd been through partial plates, false teeth that wouldn't stay put no matter how you put them in. When I went to PermaDontics, they assured me that they had the fix. And by God, they got it. They got it right. It wasn't really too hard for them, I don't think, because they're so good at what they do.
For PermaDontics, connecting to the community is very, very important to us. And to do this, we have seminars that we run on a weekly basis, both at lunchtime and in the evenings to make it convenient for people. And we also come to exhibits like the one we're in today, which is the UT Aging Expo. So we want to inform people about what's available and how to improve their lives through permanent dental solutions.
So this morning what we're going to show you is the new center that Dr. Berger and I have built, and with specifics on why we can now get rid of your dentures. For those of you wearing partial dentures, full dentures, we now have a new technique that will get rid of your dentures in one day. So Dr. Berger and I built this center dedicated just to dental implants only. And really what the technique starts on and ends on is a 3D scanner. And what you see there is a 3D scanner that allows us to take an image of your jaw, of your teeth, of your bone. And from that we can build your final prosthesis. So what's new in dentistry today is what we're going to talk about. I'm just going to go back for 2 minutes and show you the standard way of doing implants. And what you see is a single implant, and this is a dental implant. It's made with titanium, and it's put into the jawbone. And classically, we let it heal for about 6 months, and maybe that's what you've been told, that you need to wait 6 months for everything to heal. And this is how it's been done in the past, and then the implant goes in, and then it heals for anywhere from 3 to 6 months. And once it's healed, then we put a tooth on it. And there's the implant in place, and there's the tooth that goes on it. Now, what we do differently is we take someone like this, and we transform them really, literally in the same day from missing teeth, broken teeth, decayed teeth, maybe teeth that have gum disease, to a full set of teeth that feels like your own again. So there's no reason for you to have to struggle with dentures or with loose teeth or decayed teeth or gum disease anymore. So this is an aging expo, but basically we're going to take you back to where you were younger, to where you had your own teeth again. And we do the same thing for this lady. Okay, she wore dentures for many years. Dentures would break. She'd get sore gums, irritated gums. She couldn't really eat well. Now, how do we do this? How do we go from a lady like this, when she walks in, she's wearing partial dentures. She actually wouldn't wear the partial dentures. They were in her purse when she came to see me. Why? Because they would irritate her, irritate the gums, cause pain, and they didn't look good either. So this is the secret. This is how we do it. We take a 3D scan of your jaw, and we start planning it on the computer. So we actually do 2 separate plannings. We do the planning on the computer, and you can see how I'm planning where the implants have to go. And this is another lady, same thing. And you can see how the implants now have been put on, image on the computer, exactly the position where we want them to be. Now, the next thing that we do, which is different to, we think, anyone else, certainly in San Diego and in California, is we make a 3D model, an exact duplicate. It's a medical model from the scan of your jaw. And with that, we're able to do the planning in advance. So we actually do the surgery in advance on this model. Dr. Berger, who's the surgeon, will be talking in a minute. He goes in and he takes the models and he places the implant in the best position that for your bone. Now remember that in the jaw, in the lower jaw, there's a nerve that we want to stay away from, and in the upper jaw, there's areas that we want to stay away from, the sinuses, the nose. And because he's able to see this now, before he goes into your surgery, this makes it a lot safer because he can see things before that he wouldn't be able to see. For example, if you look here, here's the nerve. See this white thing here coming down? It ends right over there. So we're able to put the implants in away from the nerve. And this is all done on your 3D model. Up here, there's sinuses that come in. We want to stay away from the sinus. Some of you may have been told that you need bone grafting because you don't have enough bone, or maybe your dentist said you don't have enough bone, you're not a good candidate for implants. When we do it this way, we're able to utilize all the available bone in your jaw, and 99% of the time we don't need to do bone grafting because we can see it ahead of time. Now, in our center, we've built a very state-of-the-art center. We have a full-on laboratory where we design everything. The guides for the surgery are designed there, and the actual teeth are designed there. We have a master technician who works closely with me, and we decide ahead of time how you want your teeth to look, the color of the teeth, the shape, the size, everything. And this is him. This is Robert working on a set of teeth. Go ahead. And this is what he does. He does 3 separate things. Firstly, he makes what's called a bone reduction guide, which guides Dr. Berger to the exact position of where your bone needs to be. Then he makes a surgical guide. A surgical guide is made from what Dr. Berger did, the surgery that he did on your 3D model. He makes that to sit perfectly over your bone. So that'll guide Dr. Berger at the time of the surgery exactly the precise position of where the implant has to be. So we know the angle, we know the diameter of the implant, and we know the length of the implant before we start. So it takes a lot of guesswork out of it. It makes the surgery very precise, very accurate, and also it reduces the time of the surgery. So these are the teeth now that we're planning ahead of time so that they'll be ready for that day, the day of the surgery, where the implants are put in and the teeth are put in the same day. Now you see a little space there. That space is especially designed to allow for your gums to sit in there. Because what you're seeing is the bone, and there's no gums here. So the gums are usually about 3 millimeters thick, and we leave that space for the gums. Next slide. And this is the lady the day of her surgery. Next slide. And here you can see how the implants have been put in exactly the same position that they were designed on the 3D model. So it's very precise, very accurate, and very safe as well. So these implants now will support her teeth. Now these are not teeth that come out. They're not dentures, they're not snap-on dentures, they're not removables. They're going to feel like your own teeth. They're attached permanently to your implants. When you leave that day, you got teeth, okay? And they feel like your own teeth again. So it can put you back 20 or 30 years to when you had your own teeth before. Next slide. This lady was very unfortunate. She'd lost a lot of teeth through medications that she was on. Her teeth decayed out. She basically became a recluse. She wouldn't leave her house. She didn't have teeth to eat, couldn't smile, and she was looking for a solution. She was told she needs all sorts of complicated treatment. It's going to take a year. She's going to have to wear dentures, and she was looking for a solution. And we told her that we can plan it. We can do everything ahead of time. It takes us about 2 to 3 weeks for the planning. And then on the one day when she comes in, we're going to take out her teeth, we're going to put the implants in, and we're going to attach permanent teeth to her implants. And so she left with teeth that were attached like that permanently to her implants. Surprisingly, very little pain. We're sometimes surprised how little pain there is. We give our patients pain medication the day of the surgery, and often they don't take it. And you question, why is there no pain? Well, pain mostly you get from the gum tissues. Right? When you have a denture or any pressure on your gums, it's painful. But the system that we have designed, the teeth are not touching the gums. And there's no pressure on the gums. So when you bite down, the pressure is distributed to the implants, which are sitting in your jawbone. And there's no pain inside the jawbone. So we have patients report very little pain at all. And this is the lady a couple of weeks after the surgery. really changed her whole life, as you can tell. She's now a totally different woman. She dresses differently. She did her hair differently. And she's very happy. And you can see that before we started, she wouldn't smile. She didn't want to show us her teeth. But you could see the difference. So this is another gentleman who came in wearing an upper partial denture. You can see he's got some teeth left and a lower denture. Actually, he never wore his lower denture. He had it also in his pocket. Okay? So we did the whole thing. We designed everything ahead of time. We talked to him how he wants his teeth to look. My technician made the surgical guide, made the teeth, and there's the 3D model you can see. And we had everything planned, and the day of the surgery we took out, he had 4 teeth left. We took those 4 teeth out, we put the implants in, and then we put the teeth on the same day. And he left like that with teeth attached to the implants. So Dr. Berg and I have been doing this technique now for over 13 years. We've published our results on it. We know it's successful. And so we give a lifetime guarantee for this. And that's Richard. And if you want to meet Richard, he's actually a Vietnam vet. He'll be here at about 11 o'clock. You can talk to him. He'll tell you his experiences with the surgery, how his teeth feel. I think he's now about a year or year and a half after we did the work. So you'll be able to talk to him. Okay, another patient. This was a pilot who had also an upper partial denture. His lower teeth were not too bad, but the upper teeth, you can see he was missing a lot of them, and the remaining teeth were breaking down. We did the same thing. We designed everything ahead of time, and this is the day of the surgery. The teeth were attached to 6 implants, and he left with permanent teeth attached to those implants. There you see the 6 implants. No bone grafting needed to be done, and we didn't have to wait 6 months for the healing. And this is another patient with a full denture, and you can see how we designed it ahead of time. This is a cross-section. Because it's a CT scan, we're able to see, like you slice an apple, you can see the cross-section of the bone. So we can measure the width and the height of the bone. So we know ahead of time what your bone looks like. And everything's planned ahead like this in the lab by the technician. And that's the day of the surgery. Pretty much this is the standard procedure that we do now for these patients. And you saw this patient before. So Dr. Berger is going to talk to you about the surgery, what's involved in the surgery, how we screen our patients before we do surgery. And if you have any questions after that, we'll both be available.
Good morning. You've met the brains, now you met the brawn. So Dr. Ayers and I have been working together for actually almost 30 years, but we've been working specifically on this type of program for about 13 years. And we sort of were part of a group of people nationally and internationally that developed what is known as immediate load prostheses, which means that we could take teeth out or replace missing teeth with an implant-supported prosthetic immediately. And that's taken a number of years to develop. But now we have something that we know works, and we know works for the long term, and that's why, as you heard Dr. Ayers said, we give a lifetime guarantee on this procedure because we know it's successful and we know that it will work for you long term. This is an aging expo, and we all know, me included, that as we get older, food becomes more important in our life because everything is based from a social so interaction is based on food. We get together with our families on holidays. We interact with them generally on holidays, Christmas, Thanksgiving, etc., etc. So eating and chewing properly is important not only in terms of getting the adequate nutrition that we need, but it's important in terms of a social interaction. And so missing teeth and losing teeth really affects our ability not only to get adequate nutrition, but also in terms of social interactions with our family and our peers. So it's very important to be confident when you're able to chew and eat, as well as from a social standpoint, but also from a nutrition standpoint. And we all know as we get older, keeping our energy up and getting adequate nutrition is critical. The technique that we've developed is one that minimizes time and minimizes pain. And those are the two key elements that most people seeking implant therapy want. They don't want to spend a year waiting for their teeth, and they don't want to be inconvenienced with a lot of pain and swelling that's going to take weeks and weeks for them to recover. And so Dr. Ayers and I have spent basically the 13 years that we were used to develop this technique to try to limit those two things. And so how do we do that? We do that by all this pre-planning that Dr. Ayers described to you. So the whole thing is pre-planned on these stereolithic models, and that's one of the key things about this technique. And that's because we do that, we could eliminate the most painful thing in implant dentistry, and that is bone grafting. And I remember many years ago, I'd tell a patient, well, you don't have adequate bone, we need to bone graft you, and the patient would be exiting the door because that scared them, and for good reason, because bone grafting is painful, it takes time for the bone to heal, there's lots of complications that can occur with bone grafting. So if you can eliminate the bone grafting aspect from dental implants, you've done a huge sort of improvement for the patient's ability to have the procedure done. And this technique pretty well eliminates bone grafting as an option because we're able to find the bone that the patient has that we could put the implants in. And also, you've noticed on the x-ray, and if I could find another x-ray for you, let's see, here we go, maybe I'll have to back up. We put the implants in on angles, okay, and that's the big secret in this whole development, is we used to think you'd have to put the implants in perfectly straight. And that's why you would end up bone grafting all the time. Now you can see as we go back in the mouth, the implants start to angle, okay? And in the old days, it was thought that if you put the implants in an angle, they wouldn't work. But that's the big difference. That the data shows that you could put implants in on angles and they'll work perfectly fine as long as you connect them together. And so that's why we could eliminate bone grafting. And that's a huge win. The other thing that we've eliminated is time. So we're able to shrink the time when you get your teeth in your mouth. And we've shrunk it to 0. In other words, you get your teeth immediately. How do we do that? It's all because we pre-program and we design everything on those stereolithic models that Dr. Ayers showed you. So we're able to make the prosthesis in advance, and at the same time that they're placed in your mouth, that prosthesis is screwed in. So when you leave our center, you feel like you have teeth in your mouth, and you'll have the exact same feeling as teeth. Now, why is that? What's the basics in terms of anatomy and physiology that we could put in an artificial dental implant, and you could walk out feeling like you have teeth in your mouth? Well, it stems from the fact that when you had teeth in your mouth before they were removed, there were little nerves that went into those teeth, and those nerves, their function was to tell your brain that you had teeth in your body, so that you knew that there was teeth there. There's an area in your brain called the homunculus, and what that does is it tells your brain exactly where the surface areas of your body are. In other words, you could close your eyes and somebody could touch you on your shoulder and you know, well, that's my shoulder. Well, that's because this part of your brain orientates your surface area in 3 dimensions, so you know exactly where your body is in space. Well, teeth have the same type of thing. So when you bite your teeth together or touch your tooth, your body knows, oh, that's sort of my tooth that's on the right side. Well, when a tooth is removed, those nerves still stay in the bone, okay? Now, when we put an implant in the bone and you bite down on this prosthesis, the force of occlusion, or the force of biting, bites down directly on the implant. The implant is directly connected to the bone. Guess what? Those nerves that are still there, they're still connected to your brain, so when that force is recognized, your brain tells you, oh, I got teeth. Now, a denture sits on top of the gums, not on the bone. So when you bite down on a denture, the bone doesn't get stimulated, it's the gum tissue that gets stimulated, and those nerves that tell your body where your teeth are don't get stimulated. So that's why when you wear a denture, it feels like a big glob of plastic. while when you wear an implant-supported prosthesis, it feels like teeth. So you'll get the feeling immediately that you have teeth in your mouth. Now, we're very, very careful about how we do this surgery. If you're on medications, we check with your physicians to make sure that you're able to have the surgery done. We do the appropriate blood tests. I'm both a dentist and a physician, so I'm able to sort of deal with your medical issues. All the surgery is done with you sleepy and relaxed in our facility. We have a beautiful operating room. The operating room is what we call state certified, meaning it has the same capability as an operating room at the hospital. It has all the backups, all the safety features like you'd go to a hospital surgery center. We have a board certified anesthesiologist that does all the sedation so that I'm doing the surgery and he's watching you. So you have two board certified doctors looking over you at all times during the procedure. When you wake up from the surgery, you then get transferred over to Dr. Ayer's portion of our facility, and he fabricates and inserts the prosthesis. The whole thing takes about 2.5 to 4.5 hours, depending if you're having just upper prosthesis or lower, one arch or two arches. Do you have anything else to say? Yeah, so we're ready to take any questions. Yeah.
Am I to understand that your procedure is mainly for full mouth dentures?
Well, we can.
One or two teeth?
We could do one or two teeth as well with this technique. But the big, huge advantage, obviously, is when you're missing multiple teeth. But obviously, you could apply the same thing if you're just missing one or two teeth.
But the whole procedure would only take from 2.5 to 4 hours?
Oh, it would take much less. If
with
you're
all your 3D CAT scan?
Right, because that's done, we're talking about your time.
Okay, would that be post-op?
No, it doesn't include the post-op checks that we have to see, but the procedure to get the implants in and get the prosthesis in runs 2.5 to 4.5 hours, depending on what we need to do.
Yeah.
Yeah, if you have periodontal disease or have experienced bone loss, what is the prognosis for this procedure?
Yeah, Dr. Ayers will answer that one. For the audience, you got to talk in here.
Okay, so the question is if you have bone disease or gum disease, or periodontal disease, and you're going to be losing your teeth.
Or bone, if your bone has melted away.
If your bone is melted away, right. So the question is, your bone is melted away around your teeth. Then what's the situation? How do we deal with that? So you know that if the bone melts away around the teeth, you still have bone below the teeth, right? So let me see if I can get over there and show you. So right here, if you've lost this bone around this tooth, from here to here you still have a lot of bone, right? So what we do is we take the tooth out, we clean the area, we remove all the infection, and we go down below where that bone infection was, and we start there with the implant positioning. So basically we take care of your gum disease altogether. The good thing also about implants is that they don't get infected the same way that a tooth does. See, the tooth has the gum around the root, and the bacteria go down between the gum and the tooth, and that's how you get gum disease. And then it breaks down the bone.
Second part of that question, what was the prognosis for someone that would have advanced bone disease or periodontitis?
Okay, so the question is, what's the prognosis for someone with advanced bone disease? You're talking about the prognosis of your own teeth?
Well, yeah, okay.
Yes. So we really have to look at each person individually to see really what kind of bone loss is going on in your teeth and on each specific tooth to tell you what your prognosis would be. And you're very welcome to come by our center, which is basically just up the road. It's about 3 minutes from here, where we will do a scan, and we can give you a consultation, a free consultation, and tell you exactly what your situation is.
Yeah, let me just try to answer your question. Yeah, in generalities. As we get older, we don't get cavities, we get periodontal disease. And the research tells us that periodontal disease is not as much an issue of you taking care of your teeth. It has to do biologically, and it's based on a genetic sort of problem of an immunological issue. And that's why people with periodontal disease that's fairly advanced, in their families, their mother lost her teeth early, their father lost their teeth early, so there's a familial sort of relationship to that. And so you could spend tens of thousands of dollars attempting with periodontal surgery to maintain these teeth, okay, having all sorts of periodontal surgery. The beauty of this technique is it eliminates that, because when we take your teeth out, you don't have any more periodontal disease. That's gone. And when you put implants in, the biology totally changes. So that probably 95% of all our patients have advanced periodontal disease when they start off. And once the implants are placed in, they don't have advanced periodontal disease anymore. It eliminates that. And it eliminates it because the cause of the periodontal disease are the teeth and the periodontal ligament around the teeth. Implants don't have a periodontal ligament. Implants are fused directly to the bone. And that's why people with advanced periodontal disease are great candidates for implant dentistry, because it eliminates their periodontal disease and gives them teeth that they could function with the rest of their life.
And speaking of life, how long do these, this is a new procedure, so maybe...
Well, it's 13 years.
Repeat the question.
Yeah, so the question is how long are these prostheses, what's the lifetime of these prostheses? And what could we tell you? Well, we've been doing this technique for 13 years now, and we've had less than, we've had 100% success. In other words, all our patients, excuse me, with these prostheses are fine and doing great, okay? And we expect that they'll last the rest of their lives. There's no reason why they would suddenly start failing. Obviously, there's certain issues that increase the risk of failures, okay? Smoking for one, and then diseases that you may get in the future can obviously affect implants. Well, we can't predict that, but all we could say is that every patient that we've treated continues to wear their prosthesis, continues to have success, and that's why we give a lifetime guarantee on it. Yes?
I've had 4 dental implants, not by you guys. Each one took 6 months before the total process was completed. Why is yours so quick? I got here a little late, so maybe you discussed it already, I guess.
Well, the question is this gentleman had 4 implants. Each implant took 6 months to complete, and he's asking why can we complete it quicker? And that was what Dr. Ayers was talking about initially, was that because we're able to put the implants in where your bone is best, okay, and we could predetermine that based on our 3D CT scan, we're able to put the implants in with what we call very high insertional torque, okay, because we're in the old days, or even today, most dentists that put implants in are basing it off an X-ray that's 2-dimensional. So they're guessing at the quality of the bone, the thickness of the bone, and so they're guessing on that. And because of that, they're guessing on how to put the implant in to get it at what we call a high insertional torque. Because we could put them in at a high insertional torque, then we don't have to wait for the bone to fuse to the implant for 6 months. We could speed that process up much faster.
Thank you.
Yes?
Would you talk about aftercare?
Yes, certainly.
Okay, so yeah, the question is aftercare for these prostheses. Basically, you're going to take care of it like you take care of your own teeth. So we want you to go to a dentist, preferably a dentist who has a hygienist who's trained to clean implants, and we can refer you to those hygienists. And you want to go maybe 2-3 times a year, depending on how good you are at home with your cleaning. Every day we want you to brush it, and we give you special tools to floss them. But the care is really very similar to your own teeth. Any other questions? Yes?
How do we know how much it's going to cost?
The question is, how do we know how much it's going to cost? Well, each person is different, and each person has different situations in bone So the best way is for you to come up to us. We'll take a scan. It'll be a free scan, and we'll be able to consult with you and tell you exactly what your situation is and what we recommend for you and what your cost will be. Yes?
Do you take any dental programs?
Okay, the question is, do we take any dental programs like dental insurance? Unfortunately, dental insurance doesn't really cover this. So there's only certain things that they will cover. They may cover extractions of teeth, and we can help you maximize your insurance for that. But for the actual implants and the final prostheses, dental insurance won't cover it, unfortunately. Yes?
Should there be problems in the implants, can they be corrected? Or is it going to create a problem that you can't correct?
Okay, the question is, should there be problems in the future with the implants, can we correct it? So yes, the way this is designed, it's retrievable. In other words, the prosthesis that I'm going to put in your mouth is screwed into your mouth. It's screwed in with titanium screws. You cannot take it out. It feels permanent to you, but I can. So if for any reason there's an issue or a problem with something, I can take that bridge out and we can deal with whatever the issue is.
Is there additional cost if that happens?
No, we guarantee whatever that we make for you is guaranteed for life. There's no additional costs. Now, if you abuse them, and some people bite into weird things, they like to crush ice and they like to chew on pens and they like to play with forks, well, we can't really, control that. But if it's just a normal wear and tear, or something happens, we will take care of that at no cost.
How are the individual teeth tied together, the prosthesis?
Okay, good question. So,
is it like a pseudo gum, is like a cap, that covers up your existing gum?
Yeah, so the question is, how are the individual teeth tied together? What we do is we make a titanium frame. So we take a block of titanium, and if you understand how CAD-CAM works, the CAD-CAM machine will mill the titanium into a perfect precision fit on top of your implants. So now think about it, you have the substructure or titanium frame, and then the teeth are set on top of that frame. So it's all one piece, the teeth and the frame. You see it there. You can't really see the frame because the frame is hidden with inside the teeth. And that is screwed in one piece.
So that's look-alike, just like gum, but
yes.
It's sort of covered up, a layer that covers up the existing gum.
Well, the way it's designed is that it comes up to your gum. Whatever gum you have left, it comes up to your gum, and what gum is missing is replaced with a pink material. So it looks very natural when it's in your mouth.
Is it hard or soft?
It's very hard material. It's made to last forever, or as long as you live anyway. There's a question at the back there, yes. Yeah, you, yes.
All your implants in the picture seem to be in the front area. Why is there not any implants in the back molar area?
Okay, good question. So the question is, all the implants appear to be in the front. Why aren't they in the back? Let me go to a different x-ray and show you that. See, like this one, for example, right? So the x-ray shows that this implant here, okay, is going towards the back, and it's angled so that it actually exits to where your molar would be. The reason we don't put the implant further back is that you have sinuses, the sinus cavities, that generally come down in this area over here, and so we want to stay away from the sinuses. So we spread them from the front towards the back. Now your final teeth are a full arch of teeth. But we stay away. And then on the lower jaw, the reason we don't do it is because there's a nerve. You can actually see this channel here. There's a nerve that runs down that we stay away from. Any other questions? Yes? Yeah, go ahead.
In chewing, the pressure is on the molars. So it's sort of...
Okay, so the way it's designed, you see this is a prosthesis here, right? So inside this prosthesis is the titanium frame, right? Now, you know titanium is very strong. We extend the frame all the way out to the molars. When you chew on these molars, by the way, most of your chewing is not done on the back molar. Most of the chewing is done here on this second premolar. But in any case, when you chew on this molar, the pressure of this chewing is distributed through the frame into all the implants. Okay, and we have not had any of these fracture, and we've been doing this now for 25 years. So we know that it works. It has to be designed properly. It has to be a certain thickness of metal, but the frames do not break. Any other questions? Yes?
On the lower back molar,
Yes.
can you do implants on those?
Well, it depends on your situation. We can usually do implants there. We would take a scan, we would measure the bone, measure where the nerve is, and we could tell you if we could do implants. Dr. Berger is really very accomplished. If anyone can put an implant in, he'll be able to do it. So, and it's done safely. So everything's planned ahead of time and measured ahead of time. So if you come in, we'll be able to tell you if you're a candidate or not. Yes?
If it's just one tooth in the back that's broken off, should you get a thing like this, or is there a different procedure?
Well, we'd have to look at you again and see what your situation is. If you're only missing one tooth and everything else is intact, you may be okay. But again, we want to look at your other teeth, make sure they're supporting your jaw and supporting your bite, because you don't want to put too much pressure on your other teeth, because then they're going to break down. So it's a good idea to replace any teeth that are missing. We don't recommend replacing the wisdom teeth, though. We feel that you can do without the wisdom teeth.
The molar, yeah.
Yeah, the molar you really need. Yes?
Okay, what if, like the teeth that you have right
Okay, sorry, this is the last question.
if the teeth that you put in for us, if one should wear down, deteriorate, or crack, can
Right.
you replace that one?
Yes. Yes, we can. We have a technician in our office, and like I said, I can take the prosthesis out. He can repair it. If there's a broken tooth or something that happens, he can usually repair it within an hour, and we'll now screw the bridge back in again.